Greetings. Good afternoon, good evening rather. It is 5:30. Today is April the 20th, I believe. I don't know what the date is right this second, but I do know it's April 2017. And it is I'm trying to see with our People's Counselor, Charles Patton. He's trying to tell me that it is April, the two hands up is the 10th. No. 20th. No. 23rd. Huh? The 19th. Horrible hand signals. I don't know what that was, but I guess that's 19. So, we would like to welcome you to Can TV Live. This is your hostess, Sister Ya, and I am with Tacts, the Association of Clinical Trial Services, where we bring science to the people. And when we say bringing science to the people, we're really talking about the science around, and more specifically around health, education, awareness, and of course, we want to make sure that we can afford it, our health care, and the science that is involved in all of that is making sure that you understand how you can become infected, affected, and more importantly, protected. Hey, now. And this is what this show is about. We work on the auspices of health equity. I'm also joined here. You can always call 312-738-1060 so you can talk to our PC, the People's Counselor, Mr. Charles Patton. He's there waiting for you to call. So if you had any questions about anything that have to do with health, health equity, that whole lens of infectious diseases, I would be the person you can talk with. I am a community epidemiologist with Tacts, the Association of Clinical Trial Services, and what I do as a community epidemiologist is bringing that science to you the best way I know how. And if I don't know how, well, then I'll find someone else that does, or at least we'll do our best to talk it out. Now, I want you to recognize that when we do our aspects of clinical trials, we are talking about people who need to be all diverse, all types of people involved in clinical research, because this is what makes our trials better. As you can see, these are some of our partnerships that's been working with us. We have the Center for AIDS Research, Third Coast, we have the Men and Women's Prison Ministry, we have the AIDS Health Foundation, we have the AIDS Foundation of Chicago, and Flow Photography and Enterprises, of course, the National Black Agenda Consortium. These are the people that we work with to understand how Tacts operates, and more importantly, how do we get that science to the people. Now, in bringing that science to the people, one of the things that I have to do is teach about health equity. Say it with me, health equity. Now, you're probably saying, well, what is health equity? Health equity is not equality, but it is providing the most possible resources that you need to get the best possible outcome. So you see these two pictures, right? And you see the one that's on my right here with the taller person standing up that says equality. See, they're already taller. They have the one box. Everybody gets the same box, but people who are taller do better because they're more privileged and they're taller. Well, with equity, it doesn't matter how tall you are, how short you are. What matters is the resources that you need, and everybody gets to see the same thing. And as you can see, that the shorter person needed 2 boxes, whereas the tall person didn't need any. See, that is what we mean by health equity. Equitable distribution based on where you are at the time of your need. And that is a construct in healthcare that I would like to take on specifically for people of color. Black people need to look at the lens of health equity because we are always in the position of being a disparity, a dismays, a dismissed, and unfortunately distinguishable by our race and ethnicity. Too many disses for me. What about if we just change all of that and do the health equity? What that would allow us to do is not just compare ourselves to the bigger population, but compare ourselves to our own selves, as well as other people in the different parts of the diaspora, the African diaspora, that assimilate the same conditions as us, so that we can talk about how we use the resources that we have to leverage a better health outcome. That is what health equity is all about. Leveraging a better health outcome. And that's what we're going to do as we learn more about health equity. So when you're talking and you hear the people say, oh, it's a disparity, I want you to correct and redirect them and say, no, it's health equity. And then I want you to tell them that they've got to play their part. Either see this triangle, there's 3 pieces of the triangle, and then in the middle is health equity. And in that triangle you have the part that's the institution, you have the part that's the policy, and you have the community capacity building part. And within there are programs, services, and data and research. That is where I specialize, the data and the research. I also can do the program and some services, but I specialize in the data and the research. So I'm part of that triangle. And what I'm trying to do in this triangle is build the community capacity to understand health equity and fold into that, as well as engage in that process, so that we can have what? Better health outcomes. This is the call-in live show. If you want to understand more, give me a call at 312-738-1060, and you can talk to our PC, Mr. Charles Patton, the People's Counselor. But as we think about health equity and we wonder where we are going with this, I want to bring up a serious topic with you all for today's talk. In this particular viewing for today, I want to focus on a concept around righteous contributors. What is a righteous contributor? Well, sometimes a righteous contributor is a person that doesn't even know that they are contributing. Most of the time, they're not told, they're not given the opportunity to consent, or they don't even know that it's happening. All they know is that somehow, some way, it is something about them that contributed to the bigger society. Well, let me bring it down a little bit. That was very lofty, but I'm going to make it a little bit more specific. There was a lady who had, and for all intents and purposes, what we would consider the human papillomavirus virus. We call it HPV. It is a virus that impacts and infects mostly women, but some men. There are 4 strains that are the most active that can lead to or possibly cause cancer. There are several strands of HPV, but the 4 that are the most significant are the ones that can possibly cause cancer. Unfortunately, this particular individual had HPV that caused her cancer, and unfortunately, it brought her demise. She ended up passing away from HPV, but they took pieces of her body, more specifically grafted her cells from her uterus, and they used those cells to cultivate and to come up with, of all things, a vaccine. It is a vaccine for polio, which nowadays we don't even know. Most of us in this day and age don't know anything about polio, but it used to be a disease that wreaked havoc on our populations here in the United States, and it was debilitating. And so a doctor named Dr. Jonas Salk decided that he would take those cells, he cultivated, he put it in, and he worked it like in a petri dish, and he made sure that he had all that he needed with all the different particles of her cells, and came up with this vaccine. Magical, right? Yes, but he never asked her one time, could I use your cells? Would you consent to me even thinking of trying this type of process? Are you okay with us taking pieces of your body and using it for science without your consent, knowledge, or know-how? Her family didn't know anything about it. No one knew what they had done except for the doctor, who By the way, because she was a black woman, they hid her identity and called those cells HeLa, H-E-L-E, or HeLa, however you want to pronounce it, but H-E-L-E. It stood for Henrietta Lacks. So what they were trying to do was mask her name by just using these 4 simple little words or letters. Well, that story got out. And unfortunately, it was brought to bear that they never asked her consent. So all of the things that they've done with her cells, they grafted it, they've made vaccines. Her cells has went to the moon and back and has survived, well, at least space and back, and has survived. Her cells has been used in HIV treatment. Believe it or not, they have used different particles of her cells for all types of treatment across the spectrum. I was even told that a vial, one little vial of her cells, pure cells, can go for $10,000 or more. So here it is, her cells are still living, and she is not. And her family was never given their just due. Now, who am I talking about? No other than Henrietta Lacks. You may have seen this name before, but the reason that I am bringing it up is because with Henrietta Lacks, we do a tribute to people who are righteous contributors. Henrietta Lacks was a righteous contributor. Even though she knew nothing about it, it is because of her cells today that we have the polio vaccine, and she has contributed so much more to science and research just because of what she had. Now, that gift that she had, unfortunately, was not shared with the general public of her family and her friends, and they did not benefit, but doesn't stop her from being a righteous contributor nonetheless. So what we do during the week of Women's Health Week. By the way, that week is always the second week of May. This year is going to be May 14th through the 20th, and May 14th through the 20th is considered Women's Health Week. And for that week, what we do as in Tacts, the Association of Clinical Trial Services, we bring honor and attention, and we showcase women who have been righteous contributors to those of us that are in healthcare. The name of our particular event is the 7th Annual Women's Healthcare Network and Social. The 7th Annual Women's Healthcare Careers Networking Social. And what you can see is you can go to Women's Social One at eventbrite.com, womensocial1.eventbrite.com, and you can go there to register to come to this networking social. What do we do at this networking social? Well, we highlight other women who have contributed to healthcare as in a career. So that's why we call it Health Careers Networking Social. We want women who are practicing healthcare one way or another. I mean, whether you're a doctor or a nurse or an epidemiologist, whether you're a pharmacologist, a researcher, or a clinical trial specialist, or whether you are a person that is an activist or an advocate in healthcare, we honor the women who are righteous contributors to themselves, their communities, their families, and of course, the world. We have some outstanding women that we honor, and for the past 7 years has been a delight to come across so many women of color who have been providing insight to better healthcare outcomes. More importantly, we're networking to see where it is that we can possibly get better careers, a better job, or if nothing else, just knowing someone that's working in somewhere. And when you need some answers, when I need something done in cancer research, I know I can call University of Chicago. When I know I need something in diabetes, I know I could call another place or Mercy Hospital. When I know that I need help in HIV, I know all the physicians that I can give a call to or researchers and say, hey, I need a little bit more information. That is what the networking social is all about. Women networking with each other so that we are not hidden figures. We're not hidden. Just everybody's not looking. So I'm going to bring these women out and make sure that they are seen before the world and acknowledged in our community. Women of color specifically. That means Black and Latino women. And yes, We are the only organization who has provided a platform for transgendered women of color as well, Black and Latino transgendered women. We are inviting them to be a part of the fold since that is how they're identifying, and they are looking at this as being righteous contributors to our society, to their communities at large, and we welcome them. That's a little different for people, but this is what a righteous contributor can do. All types of people come, and more importantly, guess what? Men come too. That's right. You don't have to be a woman just to come, or identify as a woman just to come. We want men to arrive and come because guess what? We all are networking. No matter who they is being honored or highlighted, we are networking together so we can have a better platform for healthy outcomes. And we do this every year during Women's Health Week, which is now May 14th through the 20th. So I hope you come out and you participate in this social. It is free. However, we do appreciate whatever it is you can do when you arrive. Again, if you want to make sure that you please register, go to womenssocial1.eventbrite.com. That's womenssocial1.eventbrite.com. Now, as we said, this is a call-in live. If you want to call me and get more information, call 312-738-1060. And these are the types of events that Tacts loves taking on. And we deal with health and we deal with science. More specifically, I want to talk to you about leading up to our Health Equity Equal Black Unity Healthcare Campaign. Now, this campaign was kicked off during the National Black HIV Awareness Day, and these are two palm cards. I know they're a little small, so you can't see all the print, but I'll let you know what it's talking about. The print is telling you developing health equity through community capacity building. Remember that triangle? Well, there I'm bringing it back up. We have ongoing presence of health by utilizing the concept of health equity to impact our resources and to improve our health outcomes. And the different ones we're dealing with is partners health, we deal with provider health, we also are dealing with services, and more importantly, we're dealing with specific health elements. So let me just outline the ones that we are looking at. Not that the others aren't important, but these are the ones we're thinking about. Cancer of all types, of course, that's very high on the list. But then so is diabetes. We're looking at hypertension, specifically heart and stroke diseases. We're also looking at, of course, HIV, hepatitis B and C. We definitely think about STIs included into that, but then we're looking at mental and substance abuse. Mental health and substance abuse is a arena in which we really have to do a lot more work to get a lot more traction for people that are going through these issues. But we're also thinking about how we deal with violence, and we want to say violence prevention is what we really want to say. And then we have preventions and interventions. Now, I am bringing up the point of interventions because sometimes we can't prevent what has already happened, but we can intervene. Anybody ever need someone to intervene for them? Lord knows I do. But when you can be an interventionist, when you can intervene and disrupt and redirect and correct certain behaviors or redirect and correct certain outcomes that could have taken place, that is the most positive aspect of healthcare that we can provide, which is when we can change someone's health outcomes from something that wasn't healthy to something that is healthy. That is doing something. That is health equity. More importantly, figuring out those resources. So what I've just let you know is what our Health Equity Equal Black Unity Emoja campaign is all about. Those are the specific addendums to that campaign. But where would you find this information? Well, you find it in our aspect of our National Black Agenda Consortium. The National Black Agenda Consortium is where we have housed the health agenda, health and wellness agenda. In that, you can go to the website, just push nationalblackagendaconsortium.org/health. That's how you would get to where I worked on. And I worked on health and wellness aspects of this. One day at another time, we're going to go through the bullet points of that particular document, but I want the audience to know that we do exist. This is something that I have worked on for some time now, and I am glad to bring it to fruition and have it publicized out in the National Black Agenda Consortium. So these are some of the aspects of healthcare that we have promoted, that we have been doing, and I really hope that you make it out to the social. You can see again, save the date, Friday, May 12th, 2017, 6 p.m. at Mercy Hospital. It is Women's Health Week Networking Social, and I want you to, if you have to, contact us at tactsforus@gmail.com. As you can see, I'm Sister Yam, your community epidemiologist. We had Charles Patton here. He's the People's Counselor. He was here to help assist you in any way that he possibly can. He specializes in substance abuse and some mental health aspects. But again, what we're trying to do is raise the bar, and we're going to do the measurements much differently than what we've done in the past through the lens of health equity. That is what we're about. That is the trajectory in which we should be taking as an epidemiologist, that we should be taking our next level of health care. I am going to be specific on every show. We support universal health care. So sometimes, what does that mean? Single payer. And that is the aspect of health equity that we'd like to keep pushing: a single payer system, a universal health care system, a system that looks at resources and providing it to the people that need it the most so that they can have the best healthy outcomes as possible. I have just defined health equity for you. Again, this is Sister Yai. I'm with Tacts, your community epidemiologist, and we are the Association of Clinical Trial Services. I'm here on KNTV. You can also access us if you're not watching it live on TV. You can also go to the website and you can look it up, and we will be there with kntv.org. So these are the things that you can do to be supportive. I really want you to come out to the social and be a part of the networking with us and fellowship. Again, thank you for your time and your attention, and I am so glad to have been here with you today. I am Sister Yai, your community epidemiologist. Oh, wonderful. I've just been told I have more minutes to be with you. That is wonderful. In this time, then, I'm going to, at this time, take on a much more serious note. Unfortunately, we've been dealing with a lot of mental health illnesses in our current arena. Some people may say that the government is experiencing it as well, our higher people, elected officials, but I won't go there on this show. But what we do know is that if you are suffering, or you're not sure if you need to reach out and not sure about your status, whether you have HIV, hepatitis, or STI, why don't you give us a call and let us help navigate you. We will do our best to get you to a place where they will accept you for who you are and not just based on what you've done. No judgments, no shade. We want to make sure that you are provided for in the best way possible. So if you need some help, or you need someone to give you some patient navigation, give me a call or send me an email at tactsforus@gmail.com. That's tactsforus@gmail.com. I want to again thank everyone for viewing. I hope to see you May 12th, Friday, at Mercy Hospital for the Women's Networking Social. This has been a wonderful show from your hostess, Sister Yai, your community epidemiologist, your favorite community epidemiologist. Thank you so much, and have a blessed and wonderful month. We'll be back next month.